Let me start with something a little unusual. You might be wondering why I'm holding this container. These are actual gallstones, not a model, it's not a prop. They came out of my husband's gallbladder. Yep, his gallbladder. There's probably about 100 of these little stones. And until this happened, well, we didn't really talk about gallstones or gallbladder until you're doubling over in pain, wondering if you're really having a heart attack at that moment. In this video, we're going to talk about what gallstones actually are, why the pain can be so confusing because they mimic heart attack pain, why so many people, especially women, can get brushed off, and how you know when it's time to stop waiting it out. This is Health Made Simple. Let's break it down. Let's start simple. Your gallbladder is a small pear-shaped organ tucked right under your liver. And its job, well, it's to store bile. And bile helps you digest fat. Yum, I love fried foods. Gallstones form when bile becomes too concentrated or there's just too much of it, usually with cholesterol. Over time, these crystals harden into stones. Here's the part that surprises a lot of people. The gallstones can be as small as grains of sand or as large as golf balls. And the doctor that we saw said that he's seen gallstones that big. You could also have these hundreds of these tiny sand-sized stones. And the thing is, you might not even have any symptoms, no pain, until these little stones decide to travel. So if you ever felt gallstone pain, it's not subtle. And it typically happens when the stone blocks the cystic duct or temporarily gets stuck during gallbladder contraction. And what's the precursor? When does this often happen? It's usually after eating fried foods, heavy meals, lots of sauces, butter. To classically describe the pain, it's usually in the upper part of your abdomen. It's right under the right rib cage, and it radiates for some people around the right shoulder blade or towards the back. Here's the tricky part. People describe this kind of pain as crushing or burning as if they had some upset stomach. It could also be sharp. And that's how my husband described his pain, like something was punching his stomach. It could also feel pressure-like. Does these symptoms sound very familiar? Yeah, that's because it can feel exactly like heart pain or pain that you might be having if you're experiencing a heart attack. When I used to work in the emergency room, a gallbladder pain is one of the most commonly misinterpreted pain by patients and sometimes the health providers, because these symptoms may look like a heart attack. So some people come in saying, well, I thought I was having a heart attack because it feels really like some kind of pressure on my chest. Or I couldn't catch my breath, and that's probably because there were so much pain. So what does the healthcare provider do? Well, we need to rule out a heart attack. So we do an EKG, we do lab, we do imaging. The thing to note is that gallstones are not rare, so we see a lot of them come through the ER. Millions of people have them, and many don't know about it until there's this recurring pain. But once they start causing the symptoms, they usually don't stop because by then you might have developed several of these stones. And by diet, it may trigger a release of these stones, and then you might experience some pain. And there's a saying in medicine, usually related to gallstones, is that it's primarily a risk factor for people who are fat, 40, female. I know these words are outdated, but these risk factors are still real. And what's frustrating is that, at least for women, more likely to have their pain minimized or be told that it's probably anxiety, also be told that it's indigestion. Unfortunately, gallstones don't usually show up on an X-ray because they typically do an X-ray if they think you're having a heart attack. What is the gold standard for gallstones? Ultrasound. And these tools are great because it's fast, it's non-invasive, and it's very good at spotting stones. Not 100%, but a good rate. Sometimes labs are normal and sometimes they're not, which is why listening to pattern of pain matters just as much as test results. If your pain keeps coming back, for my husband's case, year after year, and it gets worse after eating, and it's usually in the same location, those are all red flags. And I wish we had our red flag up sooner than later. Complications can include gallbladder infection, also pancreatitis, bile duct obstruction, that's a big one. And these are signs you should not ignore, like fever, persistent vomiting, yellowing of skin or eyes, because that means you might be jaundice, pain that doesn't go away. It's not a waited out situation if you experience one or any of those symptoms. In my husband's case, the attacks did become more frequent. They were also more intense and they lasted longer. And it was more predictable after meals as well, especially if he had a large serving of some fatty foods. And we were traveling internationally when this happened. And yes, his surgery was done outside the US, and that's a whole separate conversation and a future video. But what matters most is this: once gallstones start causing symptoms, they usually keep causing symptoms because you may have several stones already in the gallbladder. So no amount of diet tweaks or wishful thinking can dissolve them. As my husband tried with not eating fatty foods, but of course you can't just stop eating fried food. So in making this video, I'm not trying to scare anyone or instill fear. These videos really are about awareness. If you or someone you love has recurring right-sided abdominal pain that may or may not radiate on the right shoulder or on the back, or it worsens after eating a large meal, and it feels really severe and unexplained. My husband's pain was so much he couldn't even go to sleep. So don't ignore these signs. Gallstones are common and the pain is real, and treatment can be life-changing. And we can attest to this because he no longer has these pains since his gallbladder was removed. So in the next video, we'll talk about what gallbladder surgery actually involves, what life looks like after removal. It looks pretty good to us, and what people wish they've known sooner. I wish we would have taken care of it sooner. If this video helped you, like, subscribe, and share it with someone who's been toughing it out. There's no need to tough it out, everyone. This is Health Made Simple, and see you in the next one. Bye-bye.